Welcome to Dank Gh YouTube channel, your reliable UK NMC CBT learning platform. Kindly subscribe to the channel and hit the notification button to get video updates. This video will take you through mock questions with answers and explanations to better prepare you for your exams. You can order a copy of the Ultimate CBT Guide for Adult and Mental Health Nurses to help your studies by emailing dankcbt@gmail.com. 1. Describe the primary focus of a manager in a knowledge work environment. A. Developing the most effective teams. B. Taking risks. C. Routine work. D. Understanding the history of the organization. Correct answer is A. Developing an effective team where each member understands each other's strengths, skills is very important. This fosters trust and collaboration. 2. In an emergency department, doctor asked you to do the procedure of cannulation and left the ward. You haven't done it before. What should you do? A. Don't do it as you are not competent or trained for that. Report and inform the supervisor. B. Do it. C. Ask your colleague to do it. D. Complain to the supervisor that doctor left you in middle of the procedure. Correct answer is A. As a registered professional, you are to practice within your competence. Make sure you are trained before carrying out any procedure and raise concerns when asked to practice beyond your level of competence. 3. A new registered nurse has problems making assumptions. Which part of the code should the nurse focus? A. Prioritize people. B. Practice effectively. C. Preserve safety. D. Promote safety. Correct answer is A. According to the NMC Code of Conduct, you are to prioritize people you provide care for by putting their needs first and avoid making assumptions. 4. When do we need to document? A. As soon as possible after an event has happened to provide current up-to-date information about the care and condition of the patient or client. B. Every hour. C. When there are significant changes to the patient's condition. D. At the end of the shift. Correct answer is A. According to the NMC Code of Conduct, nurses and midwives are to keep clear and accurate records relevant to their practice. It involves completing records at the time or as soon as possible after an event. 5. What is the role of healthcare professionals in relation to preserving safety? A. To prioritize their own safety over that of their patients. B. To take reasonable steps to protect patients and clients from harm. C. To ignore safety concerns if they conflict with the interests of the healthcare organization. D. To delegate responsibility for safety to other healthcare profession. Correct answer is B. Your role as a nurse is to make sure the patients in your care are protected. 6. All should be seen in a good documentation except A. Legible handwriting. B. Name and signature, position, date and time. C. Abbreviations, jargon, meaningless phrases, irrelevant speculation and offensive subjective statements. D. Correct, consistent, and factual data. Correct answer is C. Records should be clearly written, dated and timed, and do not include unnecessary abbreviations, jargons or speculation. 7. A nurse documented on the wrong chart. What should the nurse do? A. Immediately inform the nurse in charge and tell her to cross it all off. B. Throw away the page. C. Write line above the writing. Put your name, job title, date, and time. D. Ignore the incident. Correct answer is C. 8. What should healthcare professionals do if they think that a colleague's actions may be putting patients or clients at risk? A. Ignore the situation and carry on with their work. B. Confront the colleague in public about their actions. Circa report the situation to their line manager or a senior colleague. D. Take no action and hope that the situation resolves itself. Correct answer is C. Patient safety should be a priority and you are required by the UK NMC Code of Conduct to raise concerns when patient safety is at risk. Therefore reporting to your manager of senior colleague is appropriate. 9. Information can be disclosed in all cases except A. When effectively anonymized. B. when the information is required by law or under a court order. C. In identifiable form, when it is required for a specific purpose, with the individual's written consent or with support under the health service. D. In child protection proceedings if it is considered that the information required is in the public or child's interest. Correct answer is A. Patient information can only be disclosed under court order, patient's consent, or when it is required in the interest of patient or the public safety. 10. Barbara, a frail lady who lives alone with her cat, was brought in accident and emergency via ambulance after a neighbor found her lying in front of her house. No doctor is available to see her immediately and she told you she is worried about her cat who is alone in the house. How will you best reply her? A. You should worry about yourself and not the cat. B. Your cat sounded like very dear to you. Can I ask your neighbor to check? Circa, do you want me to see your cat also? I cannot do that now. D. Your cat can look after itself, I am sure. Correct answer is B. Offering to have a neighbor check on the cat demonstrates empathy and understanding of Barbara's concerns about the cat. Trial. A nurse realized she has made a mistake with patient's drug administration. Patient was fine and there was no reaction. Under the duty of candor, what should the nurse do? A. Tell patient about error and apologize it. Record it and don't tell patient as no harm was caused. DC. Discuss with your colleague. Disclose to someone you trust and reflect. Comment with your answer for feedback. Thanks for watching.